Glaucoma is a condition that causes damage to the optic nerve, which is the nerve that is responsible for your sight, due to a buildup of pressure around the nerve, and sometimes for reasons that are completely unknown to us. If you are over the age of 60, then we do recommend that you get a screen for glaucoma. If you have a family history of glaucoma, certainly we recommend that you start your screening earlier, and I'll recommend doing that at the age of 40 because you have a higher risk than normal. There are also other categories of patients that might have a higher risk of glaucoma. So for instance, if you have an African, Hispanic, or an Asian heritage, you do have a higher risk of getting glaucoma. If you've ever had an eye injury or you've had previous multiple surgery, particularly surgeries like something called vitrectomy, you have a higher risk of getting glaucoma. If you're on steroids of any form, whether that's creams and certainly if they're eye drops, you have a higher risk of getting glaucoma. Patients with conditions such as diabetes or sickle cell disease, all these categories of patients have a higher risk of getting glaucoma, and I would recommend that you actually get your eyes checked regularly regardless of your age. Glaucoma usually is so gradual that most people do not notice any symptoms whatsoever. By the time you do notice symptoms such as patchy vision or tunnel vision, that usually indicates that you already have very advanced disease. It's called the silent thief in the night for that very reason, and you have to get screening much earlier on before the disease progresses. There are some forms of glaucoma such as acute angle closure glaucoma that could present with a very red painful eye and blurred vision. A few other types of glaucoma, again, like pigmentary glaucoma, can present with intermittent blurring of vision after exercise or with halos around lights. But remember that the vast majority of glaucoma actually does not have any symptoms. Glaucoma cannot be reversed once it is developed, but we can pick up impending signs or early signs of the disease and either prevent it from happening or certainly stop it from progressing. And that is why it's really important to get your eyes screened regularly. Glaucoma is normally treated with drops, and that could be one drop or could be a combination of drops, and that works for the vast majority of people. There is also laser that is available for open and narrow angle glaucoma, and in cases that are non-responsive to laser or not suitable for laser, there are also surgical techniques, either microsurgical or more invasive surgical techniques to control the glaucoma.